In this video, we are going to go over how to properly get a treatment update from a client when this task populates in your Clio task list. So first, you will be looking for treatment providers and dates of service when reaching out for those updates. So you're going to want to ask questions about those providers. Are they seeing the same providers that we already have listed in their file? Or are they seeing anyone new? Have they stopped seeing any providers? For example, if a client says that they have had surgery at Beacon, dig a little deeper. If the surgeon may have been from a Beacon hospital, but the surgery itself may have taken place at a St. Elizabeth facility or another hospital and/or location due to the needs of that surgery. So make sure you're digging a little deeper to get specific information about the treatment that client has received. When asking questions regarding dates of service, you're going to want to ask things like, what date did they start seeing that provider? What date did they stop seeing that provider? Are they still seeing that provider? And when the last time they saw that provider was. So there's a different ways to ask the same question, because sometimes they might not know the first time you asked. So you have to, again, just kind of try to pull that information out of them. And we're going to want to try to be as specific as possible to make sure we're requesting the correct records. So when you ask things like, when was the last time you saw that provider, they may say, oh, I saw them last month. So then you might want to follow up with the question, okay, well, what date did you stop going there? When you're getting these treatment updates, make sure you are listening for clues. So sometimes you have to play a little bit of a detective when receiving the updates from the client, because they might not just flat out say exactly what we're looking for. Here are some examples of information that you should be watchful for. First, did the client mention PT or a provider not listed? Did they let it slip that they have finished treating? Because then you're going to want to figure out that date. Did they mention trouble being in a car after the accident? So some of those mental blockers. And then, do they have any upcoming appointments or procedures that we should be mindful for in our next update? So here are some things to remember when doing your treatment updates. So always go over the list of providers that we do know about. Don't simply ask if they're just seeing someone new. Always verify the address and phone numbers of the location in which these providers are at, such as if the client said that they were treated at St. Elizabeth. St. Elizabeth has many locations over northern Kentucky, so we would have to figure out if it was Edgewood, Florence, Fort Thomas, just to name a few. And then always verify the treatment start and stop dates. I have it down that you started treating in April of last year. Are you still seeing this provider? If they say no, try to get the date in which they stopped seeing that provider. And then always listen to what your client is saying. Clients do not always know what might be important, so make sure we're actively listening and not just looking for direct answers to our question. This allows us to ensure that we are requesting and receiving the correct medical records for their case.